This video will show you how to properly flush your IV catheter at home. Please follow all instructions shown in this video. Maintaining your IV catheter at home can be safe and easy. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs your doctor has ordered. Remember, the solution for flushing your IV catheter varies upon the brand of the catheter and doctor orders. For the purpose of this video, the procedure will be the same, but the solution and/or solutions may vary. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry thoroughly as well. Use a separate towel to turn off the faucet. Gather your supplies needed to flush your IV catheter. Prepare the prefilled syringe or syringes if necessary by holding syringe with tip upright. Gently pull back on the plunger, then push gently forward on plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Repeat this action if a second syringe is needed. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe and allow to dry for 60 seconds. Attach the syringe to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with contents of syringe as directed by your home health nurse. A push-pause method is recommended. Please note any resistance or sluggishness of flow. If your catheter has multiple lumens, scrub each injection cap hub with a new antiseptic wipe. Scrub for 30 seconds and allow to dry for 60 seconds. Attach the syringe to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with contents of syringe as directed by your home health nurse. A push-pause method is recommended. Please note any resistance or sluggishness of flow. All supplies and syringes can be double-bagged and disposed of with your household garbage. Wash and dry your hands thoroughly. Remember, never force flush your catheter. Report any difficulties in flushing your catheter or leaking of fluid from catheter or IV site to your home care nurse. Properly flushing your IV catheter at home is important to your safety. Please call 1-800-755-4704 if you have any questions or concerns at all when flushing your IV catheter. We are available 24 hours a day, 7 days a week. In the event of an emergency, always call 911.